Anything over those first, 3-4 days to just kind of get you over that hump. Little things like that make all the difference in sort of, making the recovery a little bit more tolerable. Hi guys, welcome to Lipstick and Lipo, your unfiltered guide to plastic surgery. It's your favorite plastic surgeons, Dr. Smita, that's me, and Dr. Amalfi. And we are continuing our series on what to buy for surgery. And today we're going to be talking about tummy tucks and how best to prepare. So we love tummy tucks, but they can be quite the chore afterwards. Yeah. So it's always better to have all the things that you might need. It is very hard to get around.
And you want all your things right by you, like you need to have a little station. Some of the basics we've talked about in different episodes are like the meds. You got to have like basic meds, like your scripts need to be filled. But then you also want like Tylenol, Advil, Benadryl, and then some stuff to help you poop because you're going to be constipated, especially after a tummy tuck. So you want like Colace, Miralax, and then some stronger stuff just in case you really do get backed up because it's pretty miserable to feel like that with all those pain meds, right? So have all that stuff so you don't have to make an extra trip.
Constipation and sleeping.
Yes.
Literally the
sleeping
two worst things after a surgery. Yeah. So sleeping. What are some tips?
Yeah, sleeping, we've talked a lot about different pillows. I love a pregnancy pillow. It's like it goes around you like a big U and you kind of sleep in it. Smita said it's like an adult boppy, which is kind of a perfect way to describe it.
Exactly.
and they're cozy. Like I still sleep in one, even though I don't need it. But it's so comfortable, I can't get rid of it, even though it's monstrously huge.
After all these episodes, I might have to get myself one.
Yes, I'll send you the Amazon link. I'll send you.
Yes, please do.
I had like a really old one from pregnancy and my daughter took it and then I got another one and then my son took it. So we're on the third one in the household. I'm sure my dog would love to sleep in one too, but they're comfortable. So get, either a huge body pillow or pregnancy pillow. It'll keep you from rolling around and then you can put another pillow behind you with that to help wedge you up because you want to be a little bit flexed when you sleep still and an extra pillow for under your knees, like a bolster pillow works really good. So you just need a lot of pillows.
Right. Exactly. A lot of pillows. You want to try to make things as comfortable as possible. And I think, what else you could get too, because a lot of people have lower back pain. Yeah. Because you're sort of bent over a lot and if you're not a back sleeper, it's uncomfortable. But just getting a little heating pad.
Yeah, that feels really good.
If you haven't had lipo on your back, obviously if you've had lipo and it's also a surgical site, then that's something that you want to be careful about. But if that's sort of untouched territory, then a heating pad actually just makes everything sort of relaxed and feel good.
Yeah, absolutely. Just some logistical stuff. So one of my favorite inventions ever is this thing called a Shiwi. So weird. It is like a pee funnel. So usually the garments that we use are like crotchless. Is that what you do too, Smita? Like it's open. And so, but it is kind of hard to pee in them because you don't want to pee on it because you're wearing it for days. So this Shiwi, you could just get it on Amazon. It's like a little funnel that you put in the crotch opening of your garment and it just helps you pee into the funnel so you don't make a mess. So it's kind of weird, but it's actually really, really helpful. So when patients get those, they rave about what a life changer that was. So you won't need it for a super long time, but it is kind of a silly little thing that's gonna really help.
Right. I mean, and that's the thing. Anything over those first, 3-4 days to just kind of get you over that hump. Little things like that make all the difference in sort of, making the recovery a little bit more tolerable.
How about the drains? We haven't talked about the drains. We
haven't talked about the drains,
Drains in a tummy tuck. So there's so many things out there for drains. Some people have fanny packs that they put them in. A lot of my patients will have a lanyard type thing that goes around their neck. Yeah. And they'll pin their drains to that when they shower. I think that makes the most sense to me. I like that one. Any other ones that your patients have had?
No, I mean, the lanyard one is the one that we sort of recommend, and it's
Same.
just easy because then you know where the drains are at all times, and you're not worried when you're trying to bathe and shower. And just having some, safety pins. A lot of us don't really have safety pins laying around, but that's always something good, so you can actually pin it.
You can clip them on
your
there.
binder, or the lanyard, or whatever, your clothing, whatever it is. You can just sort of clip everything, so you know where it is, and you're not worried about it getting pulled.
Yeah, totally.
Yes.
Belly button plugs. This is like my new favorite thing that we've started doing in the practice. You really just go on Amazon and type in belly button plug, which sounds really weird, but it's this little tiny plastic dilator that it kind of looks like an ear plug, and they come in a little variety pack. So there's like 10 sizes, and you put it in your belly button with a little Band-Aid to stick it on. And it helps dilate out your new belly button, because sometimes when it scars or it swells, it can look kind of a little bit funky. And this just helps it be like a cute little innie belly button. So it's super cheap. You can grab any one on Amazon. They're kind of all the same thing. And my patients are really, really loving it. So just make sure you ask your doctor when you can start it, because you don't want to start that right away. But that's like a fun little thing that you should probably grab.
Right. And then I think, speaking about belly buttons, though, little Q-tips, that's always good to have on hand. Just when you're cleaning the whole area, and you can sort of get in there. Yeah. So, obviously you don't want to do that initially, but it's something good to have on hand too, especially after you shower and it's all wet. The best way to sort of soak up that moisture is to just, dry in there just really gently.
Yeah, I think that's perfect. And then compression. I mean, we talked about compression in our lipo episode, but you'll get a surgical one after surgery, but then you just never know what's going to be comfortable. So just grab a bunch of styles, a bunch of different types, because you're going to be wearing compression under your clothes for a month or a few months after surgery. Sometimes and you just want to find whatever works for you. Because everyone's different, and the brands they like and the styles, they're all different. So just grab a bunch and keep them on hand and try them on, and then return the rest.
Right. And the other thing too is, sometimes the compression garments may not feel comfortable initially, but then as the swelling is starting to go down, they might work. So,
you're going to shrink.
Everything. Yeah, you're going to shrink. Everything's going to start feeling differently. Things will feel differently as well. So, it's always good to just have options, right?
Yeah, you might change sizes. Like one size might work, and then a month or two in, you might go down to the next size. So definitely good to have some stuff on hand.
Exactly.
Those are all the big
what
ones.
Else? I think that's it, right?
I think you're ready.
Yeah,
I think you have everything you need. You have your little recovery station, all your stuff, a clear path to the bathroom.
Yes.
Snacks.
You're going to sleep well. You're going to poop. And
a big water bottle is good. We haven't talked about that. Yeah.
Yeah, water bottles are
good. A monstrous one with like the numbers so you know how much you're drinking, because you literally can't hydrate enough after surgery. It's not possible.
Right, exactly. So, and it's good also to have little either like flavor packets to add in it, or IV hydration, something with electrolytes.
Yes.
Just because drinking a lot of water also, you want the electrolytes as well, and the flavor helps too.
Any of those kind of like hydration. Yeah, Gatorade, whatever you like, like. If your kids like it, it's probably good, because they love all those expensive electrolyte drinks. Those are perfect. Those are the greatest.
Exactly.
Yeah. Awesome.
All right, guys. Well, I think that wraps up this episode of What to Buy for a Tummy Tuck. And we'll see you guys next week on a whole brand new episode. We're going to talk about another procedure and what to buy.
All right. See you guys.
Bye.